You finally made the decision to start therapy. You're ready to put in the work. But right as you go to book that first appointment, you stop, stalled by the fear of unknown medical bills and hidden fees. In Georgia, administrative opacity serves as the primary obstacle to care, often creating more hesitation than the actual financial cost of a session. There is a specific legal framework that dictates how this works, the Mental Health Parity and Addiction Equity Act. This federal law classifies therapy as a mandated medical benefit, requiring insurance companies to provide the same level of coverage they offer for surgery or physical health. To see exactly how this applies to you, we are going to decode the specific pathways for therapy coverage in Georgia. Identifying which of these 3 paths matches your current situation removes the financial guesswork. Hesitation around therapy costs is largely based on outdated myths. By mapping your specific scenario, you can transform a scary financial unknown into a predictable, budgetable step. Let's start with the first pathway. Georgians covered by Medicaid through the state's managed care organizations, CareSource, Amerigroup, and Peach State Health Plan. There is a persistent cultural myth that Medicaid only steps in for severe psychiatric emergencies or crisis care. That is completely false. Georgia Medicaid provides comprehensive, ongoing coverage for individual sessions, family counseling, couples therapy, and telehealth appointments. If you have one of these 3 plans, your out-of-pocket cost per session is exactly $0. The only requirement to secure this $0 rate is choosing a clinic that is officially partnered with your specific Medicaid organization. For example, Coping and Healing Counseling accepts all 3 of Georgia's Medicaid plans. If you are on Medicaid, the financial barrier to regular care is non-existent. The only actual cost to you is the time it takes to schedule the visit. The second pathway covers commercial insurance, coverage provided through your employer or the marketplace, like Humana, Aetna, Cigna, United Healthcare, or Blue Cross Blue Shield. These plans typically result in a predictable per-session copay, usually between $10 and $40. The primary source of confusion here is the deductible. Once your spending meets that deductible threshold, the insurance plan activates your lower fixed copay rate for the rest of the year. Uncertainty over whether a mental health deductible applies to a specific plan is precisely why so many people stall out on finding a therapist. Trying to decode a dense explanation of benefits document alone usually just adds to the frustration. While commercial insurance isn't totally free, getting clear on your specific deductible and copay structure turns a massive unknown into a manageable, routine expense. Whether you use Medicaid or a commercial plan, your final bill is ultimately dictated by a single variable: network status. Choosing an out-of-network therapist gives you total freedom in who you see, but leaves you with maximum financial exposure, since your insurance will cover little to none of their fee. Staying in-network guarantees you the absolute lowest out-of-pocket cost legally allowed by your plan. You can bypass the administrative stress of these calculations by using a modern therapy clinic that executes pre-session insurance verification. Clinics like Coping and Healing Counseling actively take on this friction for you. They contact your insurance, decode your exact deductible status, and tell you precisely what your copay will be before you ever attend a session. Outsourcing that verification work to an in-network provider eliminates the risk of receiving a surprise medical bill. Is the effort of navigating these networks and paying a weekly copay actually worth the outcome? You weigh the upfront investment of therapy, a copay and an hour of your week, against the compounding costs of untreated mental health issues. The costs of inaction include expensive emergency room bills for panic attacks, lost wages due to depressive burnout, and the personal toll of relationship breakdowns. Investing in a weekly copay provides a layer of preventative maintenance against these much larger financial and personal burdens later. And if you're currently uninsured, spend 10 minutes on gateway.ga.gov to check your eligibility for the Pathways to Coverage program, or ask local clinics about sliding scale fees. Insurance logistics should not be the wall standing between you and your health. Once you define your coverage path and let your provider verify the math, therapy becomes an accessible, empowering investment in your future.